Whoa, okay, this is me going through this for the next who knows how long.
The Change Podcast. Everything changes, everything stays the same.
Why does everything keep on changing?
Gemma,
Hello.
welcome back.
Thank you.
We've been with Hamish and Andy on a 3-month mandatory government-forced holiday.
Yeah, I wish this one was government enforced.
We have been slow in podcasting, but we're back, and today we're here to talk surgery.
Yeah, Change Pod is back. And this time we have some pretty major changes to discuss,
We do.
which is exciting.
Should we launch into it?
I was almost about getting ready to talk about your new glasses.
They're not new.
We're just running out of cool changes. So
Oh, that's true.
I had to go and do something dramatic.
That is true. Well, let's get into it.
Let's.
In the end of last year, you went with your mother to Thailand and had surgery.
The infamous bottom surgery.
Bottom surgery.
The most
Which-
frightening of the surgeries and definitely the most intriguing for the media.
I was telling my good friend Matthew about bottom surgery, and Matthew is on the spectrum. So he takes everything I say literally. And he was wondering whether you'd had like extra puffiness or something put in your
Brazilian butt
bottom.
lift.
So
Well, that's actually interesting to bring up because Brazilian butt lifts are the most, what's the word when you're deadly? The most deadly of cosmetic surgeries, more so than
and you're not using
bottom
deadly in
surgery.
the cool First Nations usage?
No.
Deadly as in kills you?
deadly in a literal sense.
Okay.
It has the highest fatality rate, which is terrifying. People going out there and risking it all for some thick, juicy cheeks.
Well, I did tell Matthew that that's not what was meant by bottom surgery.
Yes. No, bottom surgery is a polite way of referring to one's lower regions, the nether regions.
Sex reassignment surgery is
Yes.
the formal term, is it?
Yeah, there's many terms. Sex reassignment, gender reassignment, GRS, but bottom surgery is the like hip lingo. So if you didn't know, now you know.
Excellent.
Yeah, so
So this was on the 30th of November,
yes.
and you went to Thailand.
Mm-hmm.
Gemma, Thailand. Why Thailand? Isn't Australia's got one of the best health systems in the world, and no critique of any other place, but why leave Australia and go and do surgery in Thailand?
Yes. Well, I think we actually covered this in the last podcast.
We did we?
But
Okay.
if you want an in-depth discussion of the decision process, you can check out the previous podcast. But just to quickly cover it here, Thailand is well known around the world for their trans community, and they've had surgeons doing gender reassignment surgery for many, many years. So they have some of the best surgeons in the world, and maybe lesser known fact is that a lot of the Western world does go to Thailand for cosmetic surgeries. And so therefore their medical industry is really well funded. So yeah, it
Does
definitely
that-
was not without its fears arriving in the country and the language barrier. And yeah, there
So
was a
you went
number
over about 4 or 5 days before the surgery?
Yeah, arrived 4 or 5 days. Mum and I had also been touring around Europe for 6 weeks prior. So we arrived in Thailand.
I was working hard in Sydney to pay for their holiday.
as every good father should. Yes, very grateful to both my parents for their commitments to mine and my brother's happinesses. But yes, we arrived in Thailand very well tripped out, very homesick, ready to get home.
It's not psychedelics. That's
Yeah. Tripped out as in out of holidaying.
yes.
We've been going everywhere. We've been having a lot of fun.
Such a hard life.
We hadn't it was a beautiful distraction from the looming intensity that was to come. And so yeah, arriving in Thailand, it very much felt like we were hitting the ground running, and it was quite scary. I guess I just quickly, before we go into like the story, I just want to update people on where I'm at currently, because that will influence how I talk about things. I'm still very much in the thick of it. I'm just past the 3-month mark, which is a good little milestone, but I am not in a position to talk about the end result yet because I'm still healing. But all of the experience of going through the surgery and the intensities of the last few months are very fresh in my mind. So that's what we're going to dive into for this episode. What is it like to surgically modify one's genitals? What is that experience? What emotions does it bring up? How does it help trans people?
Yeah. Well, what is it like? What was it like that last 4 days then? How nerve-wracking. I can't fathom how nerve-wracking it must be. Was it nerve-wracking or just exciting or some bizarre combination of them both?
It was, yeah, definitely a bizarre combination of them both. I'm really, really good at putting things into the back of my mind until they're happening, which is a blessing and a curse in many ways. And so, yeah, the 4 days before were a emotional like whirlpool as everything suddenly hit me all at once, and I was really scared. I guess I had to go into the hospital a day before the surgery, and start the whole fasting process and get hooked up to the drip and everything. So yeah, it was really at the point that I was checked in and in my medical robes that, yeah, the true terror really set in.
Did you contemplate there and then getting a taxi to the airport and coming home?
Yeah, well, I didn't contemplate it to that degree. I was on a knife's edge of fleeing and screaming, squealing in terror. But I was very committed to the road ahead. So
the terror, because I'm imagining the terror probably differently to you. My terror is I don't want to lose my cock, to use the blunt term. Words you never thought I'd say on live podcast.
The modern world.
But that was the terror for you, was more, this is a hell big surgery and it's absolutely frightening, or a bit of both.
Yeah.
Even.
No, so the reason why it was a mixture of excitement and terror was because I was really excited to get rid of my penis. I started off writing a little like goodbye letter to it on the night before, and I took some like final photos, farewell shots of myself in the mirror with a penis, and it really felt like I was doing more than I needed to in the emotional processing of letting it go. Like I wrote half of the goodbye letter and then I was like, you know what, I don't need this.
Yeah. Just happy to get rid of it.
Just happy to get rid of it. But the terror was truly just the uncertainty. I didn't know how I was going to feel when I woke up. It's really surprisingly difficult to conceive of what it's like in advance. And there was just a lot of uncertainty around what the result would be like. So I was very much like riding on this hope that everything would be perfect. And thankfully, there's a lot of other trans women who have been through it before me. So I was trying to focus on the good stories. But there are cases of, difficult outcomes, butchering surgeries and
Yeah.
people losing sensation and stuff. So it was just really, that was scary. There are also a lot of complications that could arise, as with any surgery. Any number of things could go wrong.
And this
so,
does seem like a major piece of surgery. So
yeah.
Yeah. Yeah.
Yeah. I don't know if it was like,
anything where you're playing around with nerve endings, has the potential for long-term pain, I'd imagine. So, it's
totally. Yeah. And I just didn't have any reference point for that kind of pain. I've had surgeries before, but they've all been oral, like wisdom teeth and basic mouth stuff. And so, yeah, you know how when you haven't experienced chronic pain before and you kind of think that the spectrum of pain just goes up infinitely, and the maximum pain you could possibly feel is like some inconceivable amount of pain where you're just like writhing and screaming like that. I kind of imagined myself in the moments of terror waking up and I'm in an inconceivable amount of pain.
Yeah.
Thankfully, my pain tolerance is quite good. And so pain has actually been the least of my worries, I think. But yeah, so the fear was big the day before the surgery.
But you're
There was
brave.
a lot of time sitting in hospital and just waiting and just pondering and sitting in that fear. And it wasn't in, like the point that the nurses and the doctors came in and started wheeling my bed off to the hospital room. That was a moment at which I felt like I didn't know if I could contain the amount of fear I was experiencing. It felt surreal. And they put me onto the like surgical bed. I've got the white light above my head, and then they were getting ready for such a long period of time, and I was just trying to go as deep as I can into meditation, drawing on any kind of esoteric practice I know of for calming myself. I was visualizing bathing myself in purifying white light, healing light, just to do something to calm myself. It was a truly surreal experience being in that much fear and just sitting in it. I've never been in that place before.
Yeah.
And everyone's talking around me in Thai as well. So I very much felt like an alien in a space that I had no control over. Going into surgery, you already are submitting yourself, totally surrendering to the power of someone else over you. Stepping into the victim's
exacerbated
seat.
when it's culturally, linguistically different.
Yeah. There was just very, very little compassion that they could offer me in English and support. So, yeah, that was intense. And then waking up from surgery.
Because that's what it's like. You go from fear to bang, you're waking up.
Yeah, fear to
How long did the surgery take?
So I was in surgery for 9 hours total.
Yeah.
Which is a big surgery.
And then come out, and then how long does it take before you wake up? I guess they wake you pretty quick, don't they? And then
I actually kind of came to when they were moving me from the surgical bed back into my nursing bed. I came to the sensation of being suspended in a sheet and being swung by a crew of nurses and getting then thrown onto the bed.
I'm well used to this. I've had that happen so often.
The most disorienting experience. Like no idea what's happening to me, and suddenly I hit the bed and I'm out again. And then I came back to in a waiting room, and there are no words for how horrible I felt when I came back to consciousness. My legs had been up in stirrups for 9 hours. So I think obviously I was drugged, and I think that the actual operation site was quite numb still, but my hip joints were like destroyed
Yeah.
from the positioning. And yeah, just my whole body was aching and I couldn't speak. I just was like this lump of flesh in pain. I was like, oh, can someone help me? What?
Was mum
Just
there at this point, or this is the middle of the
no,
night?
this was the middle of the night in the holding room. Yeah, and I got taken down to my room and given some morphine, and I slept. Thankfully.
So you had the next couple of days, sort of, I guess, standard post-op hospital. Was that time? Were you still at peace, or were you thinking, what have I done? Or by that point, it's done. You're moving on, and I mean, I guess I'm going to ask this there's the whole question of regret. Do you regret? And I don't know what the best point to ask that question might be. Maybe you need to ask it at a couple of different times, or maybe it's just a stupid question you don't regret.
No, well, I think that the regret question can come up at multiple points, and I don't think we need to necessarily do this chronologically, because it's quite difficult too. But the point of awakening, since then, I've been through a panoply of emotions, and regret is actually not one of them, thankfully. The emotion that I first felt coming out of surgery was just the reality really hit me, of like, whoa, okay, this is me going through this for the next who knows how long. This, like, I guess it was the victimhood just hit me of just like, oh, I'm in the middle of this. I've gone from running around Europe with mum, so healthy, having so much fun, into it's complete stark opposite. And it was just like that inertia of, oh, whoa, okay, here I am. And
it has been a big recovery period, hasn't it? And as you say, you've never experienced a recovery period this long where you've had to be still and couldn't get up and do you'd actually come from a yoga training not long before.
Yes.
And,
movement has been a big part of my life for a long time, so that's been a really difficult part of the process. The first week that I was in the hospital, I was in hospital for a week after surgery. I was bedbound the whole time. You come out of the surgery and they've packed a whole bunch of gauze into the new vaginal cavity, and they have plastered around. Oh, sorry. There's also, I don't know, over 100 stitches. And then they've also plastered around the area to just really hold you steady, to let the like everything reattach. So, bits aren't just going to fall off. And so
did we
I couldn't
describe
move.
at the last podcast what they did with the surgery?
I still couldn't tell you what they do with the surgery. I am not medically inclined.
Right.
I'm squeamish as hell. If you want to know that, there's plenty of YouTube videos, and please scratch that itch.
Yeah.
Don't tell me about it.
It's so funny.
Because
I feel much the same.
Yeah. I trust the surgeon. I know that they know what they're doing.
Yeah.
It's their job to know the gritty details. I know I know the gist. I do understand what has happened to me, but I couldn't tell you the process. But yeah, so the first 6 days I couldn't eat, and I was in a bit of pain, but it wasn't unmanageable. The biggest difficulty actually was because I couldn't move, the aching. I just had the worst body aches. And this is something that I'm sure you can resonate with a lot. Laying in bed for 6 days is painful.
Yeah. I mean, over the last 6 months, I've had repeated series of pressure sores where I've had to be in bed for, series of days lying on my side, and the body, it's difficult and painful and frustrating, and
it really pushes you to like, the discomfort is one of the most trying emotional experiences, I think, because every cell in your body is screaming out to do something about this, and there's nothing you can do. So that was annoying. Like, being stuck in bed for the first 6 days was the most difficult part of the whole process for sure. There was I just had to surrender. I watched a lot of television. They were the longest days. I've done a 10-day Vipassana, meditating for 10 hours a day.
Which I can't fathom. That's a silent meditation for 10 days.
If I could have meditated for 10 hours on these days, I would have. It was horrible. It was, thankfully I did have a carer who could help move me a little bit and massage different muscles.
And Mum was there.
And Mum came every day and hung out with me during the daytime, so that the days were like very tolerable thanks to Mum's presence mostly. The nights were really difficult because it would take me hours and hours and hours to fall asleep. Also, I hate morphine. I think next time I go through a surgical experience, I'd rather the pain. Morphine just takes away my pain tolerance. It just made me feel awful.
Yeah.
On top of the pain. And so there was so many nights where I just couldn't sleep for hours, and I was feeling wretchedly ill and just gross because of morphine. And so I had a few experiences where I cried at night. It just got too much, and I feel like understandably shed some tears and just wanted to release like the difficulty of the emotion. And my carer felt inclined to tell me that, like, to just totally shut me down, invalidate me, I guess, like tell me not to cry. The person that they cared for before me was the 65-year-old woman who was just so like strong and didn't let it affect her at all. And it was just the most invalidating commentary. Like,
I should say that what they'd done because of the language barrier is essentially appoint a carer to you, but there was a cultural gap with that care as well, although the carer could speak English.
They didn't speak very good English.
Yeah, so you're dealing with linguistic cultural gaps, probably not a trained psychologist, so it was almost that was actually, I got the impression from you would have almost rather not had that carer, or
there was times when I was just really would have loved to just be in the room by myself, I could just actually go through the emotional experience of that surgery. But I was so grateful to Mum for being there with me in this time, and it was also a very stressful period for her. She would spend time with me during the day and then go home at night and spend the whole night worrying about me because she wasn't there. And
Mum, it was stressful for Mum before and after. I think Mum, she, I know the night before sent me a few quite panicked texts. I think just sort of, watching your kid go through this was pretty hard. I think once it was done, Mum's, she's always been a great support. So
she's very, very nurturing and selfless mum. So that was amazing.
I distinctly remember you sending a text with a voice recording. It must have been about 6 days after when the doctor decided it was time to get rid of this packaging. And I think, are you game? Because it's a pretty open, it's out there. There might be a trigger warning about this text. It's very revealing. But it's quite an amazing,
the audio
comedic,
message.
Intense text. So any context you want to give it, or we just play it away?
Yeah. I guess the audio message, this is assuming that we can actually play it. It's on Messenger, so by this point we may not be even able to download it. But we'll try our best. It is a description of an invasive experience, and I just want to contextualize it because uh, it might be triggering for people listening to it about the insensitivity of doctors. But I was in a medical system, and in that setting, it was it was a necessity. It was a dark necessity that doctors do sometimes just have to treat you like a lump of meat to get the job done. And if they had taken all of the extra time to be considerate and sensitive, honestly, it would have been hours, that experience. But thankfully, they did it in an intense way, and it was 5 minutes.
I guess what you're saying there is that this does sound more critical of the doctor than you intend to be. And we're playing it not as a critique of the doctor, but just to reveal the intensity of the experience.
Yes.
Yeah. All right. Well, listen away. Hopefully we can get it working.
And this is a freedom check-in. Yay! I'm finally out and mobile, and I've met my vagina, and she's happy to be in the world, but she's making her demands known. Oh, yay! It feels so good to be out and free. I'll just give you a rundown on my experience yesterday because it was pretty intense. I thought my doctor was going to be coming in at like 1:30 p.m. or something, and I haven't been able to get to sleep until like 2 or 3 in the morning every night in the hospital. So the same thing happened that night. I fell asleep at like 2:30 or something, and then I always get woken at 6 so they can wash my body. And so the nurses were coming in to wash my body at 6, and usually like they'll wash my body and then I'll try and catch a few more hours of sleep. But this time, as the nurses were walking in, the doctor walks in and he says, no, don't clean her now. We're going to unpack her wound and she can shower herself later. And I was like, wait, what? Oh my gosh, this is all happening like right now. And I was just not ready for this at all in my mind. And so suddenly I'm like mid-sleep and getting unpacked with like some of the stickiest bandaging you could ever imagine. Like, it was so painful taking it off, and they're just like hacking it off of me, and I'm sitting there like screaming in my morning sensitivity, and also just like so terrified for what's to happen. I have no idea what everything looks like underneath. Like, in my mind, everything's just like loosely attached, and like, how the fuck is everything gonna stay attached when they're just ripping it off? I'm picturing like my clitoris getting ripped off, and oh my god, I was just freaking out. and and so they're like slowly doing all of that, and then they pull all of my packing out. So my vaginal canal is like full of gauzy stuff, I guess. And so they pull that out. It wasn't painful. It was a very weird, kind of like liberating experience of it slowly like unrolling deeper and deeper and deeper inside of me as it like spiraled out. And then like I'm crying through this whole experience because it was just so overwhelming, and like, there was no one I could speak to. No one speaks English. I'm there by myself. And then they're like, grab a mirror, like, we need to show you it. And I was like, no, please, no, I don't, I'm not ready to look at it right now. And I was so scared of how gory it was going to look. And he was like, no, like, you need to see it so I can show you how to dilate. I was like, oh my god, okay. And so they're showing me it. She's like, this is your labia majora, this is your labia minora, and like everything's just so swollen. Like the labia majora is like a bratwurst, the labia minora is like a Frankfurt, and and he's like, this is the hole. Like spreads the lips, and it's just like a cavity in me. And then he's like, he dilate and sticks a like 7-inch long white dildo into me. Just, like anything you've ever heard about consent and boundaries, there's none of that with me in this, because I am the victim of the doctor. And so it's just like, whoop, I go straight in there, and I feel it go the whole way in, and I'm like, oh my God, there's something inside of me. And then he just pulls it out, and he's like, okay, great, that was excellent, you're healing really well, it looks great, goodbye. And so that is how I met my vagina. And it took me a good little while to like just cry out that experience and to calm back down. But she's amazing. She's totally functional. She's healing well. Aside from like the swelling is totally normal, but like it's an absolute marvel of modern science that it looks like a vagina even with swelling, and my scars are like minimal. I'm healing really quickly. And then this morning I just had my first care visit, and they dilated me again, and it was a bit stingy to start with, but then it was fine, and cleaned everything out. It's all very sensitive, but it's going so well, and I'm so happy.
All right, we're back. Time for an advertisement. Today's podcast is sponsored by Lark Symphony No. 1, which is a gorgeous Tasmanian distillery. And this is a high-proof, sweet, sort of vanilla, slight peppered whiskey. I think it is, it's beautiful. They're not actually sponsoring us. I just thought we could sell it. But if anyone does want to send us a really good bottle of whiskey from their local, distillery or something they really love, hey, we gratefully accept it.
Mm-hmm. That is a whiskey connoisseur, and I must admit that it's a palate that I'm still developing. But this is a really delicious one. Something that's quite enjoyable for a sunshine evening on a Saturday night out in the trees.
Indeed.
So
you're unpacked.
I'm unpacked. And can I just say, in reference to that experience, I heard a trans comedian the other weekend who did a bit about her GRS surgery, and she equated the experience of being unpacked to a doctor starting a lawnmower. And I thought that was hilarious, because it really was just get it out.
Yeah.
As intense as that experience was, once the emotions subsided, that was my first experience of having a vagina.
Yeah.
Of having something put inside me, and there was a lot of euphoria that quickly followed, of like, oh my God, this is real, this is happening. Interestingly, straight after that experience, I didn't have this in the voice recording, I don't think, but I then had to learn how to walk again after 6 days of not working, and how to use the loo. I started having to wee by myself. So all of these first experiences were really crazy. When I first stood up, I stood up with so much excitement, and just immediately this flood of lightheadedness, and just blood poured out all over the floor, and it was just like this totally anticlimactic experience for me, where I just quickly had to lay down again. Oh no, the cat's out. We have got a kitten on the loose.
We better sort this out.
Technical intermission, please.
Kitty crisis solved.
Kitty crisis solved.
I remember you, back to pissing.
Yep.
I remember you telling me the weirdness of weeing for the first time.
It was truly a strange experience. I guess I always expected sitting on the toilet for girls weeing, it would kind of like come forward more, or, like this universal mystery about where the female urethra is. It's just made no sense to me.
I thought the mystery was where the clitoris was.
For men, perhaps. But I don't know if many women know exactly, or have who has actually seen a female urethra? Does it exist? It must. But it's just one of those weird quirks of nature that it's just really hard to find. And so, my first wee was really shocking, of it just going straight down into the water. No mess, no clean with no having to shake or move anything around.
No more messy toilets, boys. And
yeah. It's been great relearning how to wee as a hands-free experience. There's definitely been, initially there was a lot of phantom sensations around the toilet. That was more where I experienced this feeling of needing to do something that I didn't have to do anymore. So sitting down, needing to move things so I didn't sit down and crush myself, and then having feeling like I needed to shake afterwards. Those were the times that I really noticed the difference.
Phantom sensation is an interesting topic to talk about, isn't it? Because people, amputees, talk about they lose the limb, and yet they can sometimes still feel something happening to one of the limb that's gone. Or in your case, you've not lost a limb, so to speak, but where the nerves are have been moved. And so, what's that sensation like when you're when different parts are being touched? And
initially it felt a lot like I could tell where they'd gotten the bits from.
Right.
Yeah, I could kind of feel this feels like the top of my penis, but it would be the bottom of my labia, kind of weird feelings like that. I very much had to remap the sensations, and
do you feel like, is that already complete? Do you so you remap by touch and looking, or how do you remap?
Oh, it just kind of happens.
Right.
Over time, I think, because there's always sensation.
Yeah.
There, even just wearing undies, I'm being touched in different places now.
Yeah.
And so it just kind of happened naturally a bit. But yeah, it was I, for a while there, I would go to sleep and I'd still have dreams where I had a penis, and that's kind of stopped now.
Yeah.
So yeah. Funny, it's definitely a strange process going through experiencing both, and I feel like I'm in a privileged position to have had experienced both already. It's really cool. There's just little strange quirks about each that you wouldn't expect. If you have the feeling of like long hair versus not having hair on your head, like I could equate it to that. They're just, you don't realize how much your hair gets in your mouth until you have long hair.
Yeah.
And so without getting into the weirdnesses of what it's like to have each, it's funny having experienced both.
Yeah. And are you happy with the result? Is it what you wanted, that looks and feels and behaves as you imagined? Does it make you feel more of a woman? I guess there's two separate questions there. Obviously, that's why you do it. I guess, the question, one of the questions, as we've said before, not everyone does it. You don't have to do it to be a woman, but having done it for you, is it sort of cemented?
Have I gotten what I wanted? I guess would be a good way to frame that. I think I think I can still only provide a partial answer to that question. I've experienced so much amazing euphoria, and I truly do. Yeah, it's a lot easier for me to feel feminine now. I feel I do finally feel like I'm in the right body. It's like so like miraculous for me to wear tights and just be flat and not have to think about this bulge um signifying this wrongness about me, this universal glitch that I got born in a gender I didn't want to be and then had to live that life for so long. Like it's just it's nice now to be able to put those thoughts behind me and just move forward. However, there is still this sense of unfairness at the experience because it's so difficult. It was a painful surgery. I mean, I guess I made up for a lifetime of not having periods by having to go through this. And it is a really long process. I'm at 3 months. I still can't exercise or stretch. I can walk more now instead of hobbling. For a long time, I could hobble. I've been like super limited in my movements. So there's and constant discomfort and fear of
Is this going
complications
to get
arising.
normal soon?
Is this gonna normalize?
Your dad annoys you periodically by asking, "Is the pain levels reduced this week?" And
Yeah.
and they have over
I
time.
don't know. Those questions don't annoy me. I like being checked in on, checked in with. But yeah, I think to answer the question, I'm really happy. I'm loving the reconnecting to my body in this new way, but it's still too early to know for sure that it is the result that I wanted.
Yeah.
And whether I'm going to have full sensation. Like it's still not pleasurable down there yet. I guess like I messaged my trans friend the other week and I said, does it ever start to just feel like genitals again and not a wound? She said, yes, it does. But that's still where I am. It's starting to like kind of feel like genitals sometimes and a wound at other times. But yeah, the healing process is quite long.
And that's a bit nerve-wracking too, the time it's taking, isn't it?
Not really. Like this is very normal.
Yeah, that's good.
It's not necessarily nerve-wracking that it's taking this long. It's just that until it's better, my nerves are always going to be racked.
Yeah.
Because at any point something could go wrong.
Yeah.
At any point I might, start exercising too much and then I get sent back or and part of the fear around doing it in Thailand is that I don't have the closure nearby if something does go wrong that I can just quickly go and get it fixed up. Although whether or not anyone can actually go and quickly get it fixed up.
Yeah.
It's probably another whole surgery.
Are you starting to reach the point where you're getting confident that it's looking like it's going to be what they say, or you just don't want to say, you just can't say that yet? It's like things look and it's going like you expect. You don't have any indication that it's not.
Yeah, I have no indication that anything's wrong.
Yeah.
And the doctors would always tell me, it looks great. And I would be like, oh, does it? Like, is this what it's meant to look like? I haven't seen any other newly surgically created vaginas before. And
what you're saying there is not necessarily that the surgically created vagina will look a lot different to a standard vagina. For a start, all vaginas look different, but it's just that it was swollen and so it looked like a surgery, it had experienced surgery. So
yeah, it's very much starting to look like a normal vagina, and it's
if
really,
there's any such thing.
It's such a testament to the incredible skills of both, Western science and our ability to do surgery, but also the body's ability to heal, because it was garish down there. to start with, horrific. It was scary. For me, being a squeamish person, it was a scary thing to see. And it is amazing how much everything's just healing and slowly it's taking form, the swelling's subsiding. But it is a 6-month journey before the swelling is like, they say 6 months minimum for all of the swelling to totally go away, up to a year for the swelling to go away. I should have most sensation back before then. And I'm starting to, I'm really on the brink now. I think now's a good time to do this. Like, what was the healing process like? Because
hopefully you'll start to fade in your memory soon.
Yeah. Yeah. So yeah, I am feeling quite confident that it's all going really well and that it's only going to get better and better from here. Yeah.
I know you've had some good support from some trans friends. Taylor,
Mm-hmm.
I know has been, just a great friend to you.
Yeah, Taylor's been amazing through the process because she has been through it before.
Yeah.
So
it just
shout
helps
out
to
to you,
have
Taylor
peers,
Parsons.
doesn't it?
I'm very grateful for you.
Anyone else can give you support, and it's really meaningful. But there's something about
someone who's walked the path before.
Yeah.
Someone who knows what it's like.
Yeah, I thank you, Taylor. As a dad, I thank you as well because I know what that peer relationship's like, and I think for we should get Taylor on here to talk about her experience as well. Because,
yeah, definitely.
I know sometimes it's been lonely, and so yeah.
Yeah, we definitely should. But yeah, so I think the last couple of months, the biggest difficulty for me has been not being able to do much, like not being able to move, and the fear. Because I am quite squeamish, it's been such a barrier to me in my healing where I've had to really overcome these blockages in my own mind with cleaning and looking after it, because I've just been so scared that like if I move everything around too much, it will like fall apart, or the fear has been the most confronting part of it throughout this experience, and it's made me really aware of how much movement is an important part of my life and how it's like a foundation of my mental well-being. And so again, I can very much resonate with your experience through that.
Yeah,
it's really difficult, just when moving is what made you happy before, to not be able to do that, even just for a short period of time. For me, it's been really challenging accepting and trying to make the most of it. I feel like there's been a lot of periods where I've just succumbed to this like mentality of I'm just going to get through, and I've really I haven't felt like living. I've just felt like surviving.
Yeah, I mean, look, I guess it's a conversation for another day, but spinal cord injury is adjusting to the permanence of that lack of movement. And in your case, 3 months is a long time. It's not quite permanent, but it is, as you're right, our physical and psychological well-being are connected.
Mm-hmm.
In this case, again, it's a plus and minus because you've had this positive physical transition that is important to your well-being, but it's also keeping you still. And
one of the funny things about being an animal with a frontal lobe is that we can choose suffering for some future purpose.
Yeah, it's interesting, isn't it?
And very going into this, I have the weight of a lifetime of emotions, knowing that like, why do I have a penis? I was meant to be a girl. Just always knowing that deeply. And so going into this experience, like because of that, I've been able to accept the fact that I will suffer and try and go through it. But I think a lot of the emotions, then regret is not the right term. There is a question there in my mind of like, what the hell am I doing? What the heck
Why am I
is,
putting myself through
like,
this?
why do I have to go through this? And
Yeah,
I just have to accept that as a necessary evil for me because, because I can choose that battle. I can choose either do I pursue this thing that I've always felt like I wanted and go through the suffering, or do I just choose to not suffer and suffer in a different way for the rest of my life? So I am still trusting that it will, the suffering will not last, that it will be better. But who knows? It might just be different. There's probably still going to be suffering, and I've just chosen a different battle. But I am very at peace in that choice, very accepting of whatever is to come is my journey for now. And that's taken me a few months to get to.
Yeah.
After the first month, we were down in Conjola, which is our annual family camping trip. Outdoors, we're camping in a cabin, thankfully. But it was difficult being in that space and not being able to enjoy nature as I normally would. And in my impatience, I played frisbee with Jacob one afternoon and was kind of pushing myself through the pain, being like, no, movement's good, I'm having fun, and just not thinking about pain. And I actually did some more damage, and just because of the twisting motion, I wasn't aware of how much that was actually impacting me, and it really put me back. And I would attribute, little things, little impatiences that I've had to the fact that the healing process has been potentially slowed. I should be able to usually be starting exercise and stretching by the 3-month mark, and I just don't think I'm quite there yet. Possibly because I jumped the gun and tried to exercise too soon.
You have the Clifton impatience in the back of the mind there.
Well, I must.
I should say spinal cord injury. This is one thing it's taught me. As a general rule, I think I'm a much more patient person now. I've had to be. Life forces you to learn skills that you haven't otherwise had before. It's why times of crisis, whether it's chosen or forced upon you, are also times where you learn things about yourself, where you discover the kindness of others because you need it. So there's always, if life was just always a party, I mean, I guess that would be great, but we wouldn't be.
It'd get exhausting.
Maybe, yeah. We wouldn't have learned as much either. So yeah. Well, Gemma, congratulations.
Thank you.
I think there's some work changes and other things coming up, but they can be the topic for future podcasts. Is there anything else you'd say about bottom surgery, gender reassignment surgery? I got a terminology question for you that I was talking with an older LGBT friend of mine, Anthony, actually, who you'd know. Sorry, Anthony. I'm using that term positively. But he was talking about the difference between transsexual and transgender. And technically, the transsexual was post-sex reassignment surgery. Is that terminology still, or it's transsexual is not really a term that they use anymore. It's just transgender.
Yeah, I think Gen Zs and millennials don't particularly use transsexual anymore. We would just use transgender, especially because if there is a term that implies whether or not you've had surgery, that's almost giving away private information for free. That can be potentially weaponized or damaging. Dangerous. But I think I saw an interesting perspective the other day, because there is a lot of infighting within the LGBT community, intergenerational arguing about terminology. For example, there's trans men who have identified their whole lives as lesbians, and they've been part of the lesbian movement in that community, and then they've transitioned to men, and they still call themselves lesbians. And a lot of people would try and debate the usage of that terminology. And I think that I think all of our different generations, especially the new generations coming through, should respect the terminology of our elders because they fought the fight
Yeah.
for us to be able to talk about this
Yeah,
freely.
I so much agree with that. I think that I know in disability, like I owe the generation who made the political battles, whose life was so much harder than mine. My life's so much richer and better because of the battles they fought.
Yeah.
And the same is really true with LGBT QI elders as well, isn't it? And and respecting that difference, and then allowing people to choose their own labels. And,
yeah, exactly. Especially when we owe it to them. So
yeah, I'd love to do I'll do a podcast. We'll do a podcast one day on Pride and Mardi Gras and honouring the past and topic for another day. But
so I think we should definitely do a history one. There's a really good documentary we watched called Queer Australia as well. Shout out to Zoe Coombe Ma. Fantastic job on that documentary. It was really engaging and fun, as many documentaries are not.
It was hilarious.
It was hilarious.
And informative.
And emotional.
And just a reminder for why the politics of inclusion are so significant. We are not far away from a pretty terrible history of social, imprisonment.
Oh my
death
God.
penalty. Like the
we have a dark history.
Police bashing and failure to offer protection or to chase down violence and abuse. And so the history is dark.
Watch that on ABC if you're interested.
It puts the sports question. Which sporting team should the person play into perspective when you see the significance of inclusion and what it means for individuals. So please
good
watch
point.
that video.
Contextualize the modern crises. Just a flag for future. We should definitely do a queer history. I'm also we'll be doing follow-ups about this as things progress, and I would also love to chat more about gender dysphoria and how different surgical treatments can benefit, and the whole media discussion around detransitioning and stuff, because detransitioning is being used as a propaganda of anti-trans rhetoric, and there's a lot of stuff that we can unpack in that. And my own surgical journey so far has not been a simple, like a straightforward, my gender dysphoria has been vanquished. It's obviously all nuanced and just to flag that, keep an eye out. We'll be doing some good stuff in the future, I think.
Hopefully not 3 months apart, government forced mandatory podcast